possible. Now, we've gotten a huge response to this on Facebook and on Twitter already, and this is why. 1 in 3 of us in Ireland will experience back pain in our lives, and every year back pain costs the country a whopping €5.34 billion. It is a silent epidemic that makes many people's lives a complete misery. So what hope is there for sufferers, and what is it like to live with chronic back pain? Now, Mary, I know you know about this, and Andrea, I know you know all about it too as well. Can I come to you to ask you to tell us about what's wrong with your back and when this started and how you manage with it?
Well, there's 2 different types of pain. I mean, you can have acute back pain, where it be a pain that you'd have for less than 3 months, and then there's chronic pain. And there's so many people in Ireland that suffer with chronic pain, but it's misdiagnosed. So often they'd go to the doctor, and for me, I had lower back pain, and they said it was polycystic ovaries and, you know, women's kind of problems. So I was misdiagnosed for a very long time.
When did that start, Andrea?
So I always remember being in pain since about 15 or 16 years of age.
15?
Yeah, so I was always told it was kind of women's problems or women's problems and things like that. And then I went into Mount Carmel. I had a little bit of treatment done in Mount Carmel, found out I hadn't got polycystic ovaries, or I hadn't got the other one that goes with polycystic ovaries. I went to herbalists. Literally, I've seen every doctor around town that could help, you know, and nobody could really tell me what was causing this lower back pain. And it was
did
constant.
you get like MRIs and everything on your back?
At that stage I hadn't. It was just constantly there, and I used to take like Feminex and things like that. It's just a weird one because it was constantly in my life. Eventually I went over to the UK and I was diagnosed with spinal stenosis, which means I have a narrowing of my lower part of my back. And I got a great doctor over here in St Vincent's Hospital called Dr. Paul Murphy. And actually St Vincent's Hospital in Ireland is a centre of excellence for any sort of chronic pain, and they really have, like, they've pain management programmes. They have one in Tala as well. So once I got into the system, I now have a group of people around me, a physiotherapist, a doctor, a GP that understands what I'm going through. And I've got, you know, facet blocks, I've got rhizotomies where they cut off nerves, and this is like ongoing. There's a spinal stimulator that a lot of my friends, when I call them friends, you know who you are, my pain friends on Facebook that have them. But I mean, I've been very lucky because I try to live very positively, and I write diaries every day and positive affirmations, and, you know, I just accept my pain. And the biggest thing for me was acceptance, because for many years I didn't want acceptance. I wanted to get.
So would you just pop painkillers for years?
I was doing that for years. I was very depressed about it for years. I thought there was something wrong with me. There's a lot of cancer in my family. I thought I was dying.
Really? You thought you were dying?
I actually thought, no, I'm dying, or I'm mentally ill. Because I can feel this pain, but nobody can tell me what it is. And it's something I'm so passionate about, because it's nobody talks about chronic pain in Ireland.
Because that was one of the things that this survey that revealed how much it costs and everything. One of the things that really upset me reading it, and my mother has chronic pain, chronic arthritis, so I know how it can affect somebody. But one of the big things was that over 50% of people with chronic pain and with any sort of pain felt doubted by those they knew. So whether it was your employer or your friends or your loved one, because there's no visible, you know, tangible, here's a cut on my arm, here's the pain, people went, oh, geez, your one's banging on at her back again. To be doubted on top of having to deal with that pain.
Well, I never talked about it because I work as a freelance person in what I do in television and radio and voiceovers and this, that and the other, and nobody wants to hire somebody who isn't reliable.
So did you just hide it?
So the first time I spoke about it was in an article this year for Woman's Way, only that they asked me to write it on. I wrote an article, and it was part of my counselling was to come out and talk about it. I mean, I was shooting Animal A&D and nobody knew about it, and the reason I was passionate to work on a programme like Animal A&D was to highlight animal suffering and pain, because nobody's a voice for them.
So when you talk about pain, I don't know what it's like to be in chronic pain. So, like, say a really bad headache is 4 on the scale of 1 to 10. Like, where are you? Are you?
So an interesting one about how we manage pain is that you pace it, right? So when I was having Brooke, I gave birth to Brooke, and I said, I can feel a lot of pressure there. And they said, well, pain scale, how would that be? And I'd be like it's about a 6 or a 7, and Brooke was born like 3 minutes later. Now, I had 4 blood patches after I gave birth to Brooke, so I had an epidural headache, which is an epidural drip headache in the back of your head, and that was like full-on 9, 10 bad pain. When you get a flare-up around your back, I mean, it just takes over your whole life and you just can't do anything. And it's not that you can't do anything, because I can get up and walk. You know the way, I mean, you can walk. You're not that you can't walk. It's just the pain. It's very hard to describe what chronic pain is like.
That's the thing, Mary. I think if people haven't experienced it, and I haven't, I've seen it in those I care about, it's very, you know, unless you've walked in those shoes, you don't know what it's like. What's your situation like?
Well, mine is nothing like as interesting as Andrea's. Yeah, she's really interesting. I'm fascinated listening to her here. Well, I have two reasons for which I have chronic back pain. I'm an elderly nurse, former nurse, and most nurses end up with something wrong.
Hazard of the job.
Yeah, hazard of the job. And then I spent 20 years of my life dragging suitcases around the world. Another reason, even with the wheelies, you do have to carry them up and down stairs and all the rest of it. So I've seen my x-rays, I've seen my MRIs, and I just wanted to write. I said to the doctor, don't even bother reading them. I know exactly what's wrong with my back. Just write, you're finished. Or I was a little bit more graphic
You were
than
a
that.
bit more, you used a colourful term.
I did.
Yes.
Because I could see it. Now, I'm not in the kind of discomfort, obviously, poor Andrea, I really feel sorry for her. But I do notice that my capacity for walking, like I was out for a walk in Sandymount on Sunday, and I'm thinking, oh God, something down my left-hand side. But I, at this stage, barely do anything about it. I simply have accepted it.
And that's interesting, you both
and
use
I've
that
never
term
taken a
acceptance.
day off because of it.
No, you can't.
know,
You're not that sort of woman,
no,
Mary.
No.
What have you done to deal with it? Like, have you tried acupuncture
Oh,
and massage? And
I have a terrific masseur, and that sort of unkinks me everywhere. A woman in Sandymount, she's really great, tough. I mean, this isn't one of these sort of rubby things.
It's one of those, get the elbow in.
It's one of the ones where you're going, ow, etc. And that helps, no question about it. But it's not just with the back it helps. It helps with creaking and aging and all the rest of it.
But that was one of
I've
the
been
things...
to a very good physio and she had a killer thumb. And when she got into where it was hurting, whoa, I haven't been back to her for a while. But I'm fully aware that it is a serious problem, and it could be even. I notice you're sitting very close to the back of your chair.
I am. Is that good or bad?
That's good.
That's good, okay.
Yeah.
That's not by design. I don't have to work the chair.
But I can understand. Just like, for example, you were talking about, we talking about skin cancer.
In the news there,
farmers have a lot more skin cancer because they're out all day with their flat caps, and they're getting, because again I went to a doctor about something I had, and he said, you've got nothing that not every farmer in Ireland has as well, you know, the flat cap and the ears with...
So I guess you're saying if you're in a job that's going to put a lot of pressure on your back, chances are you're going to have back issues. Denise, you were telling me in Temple Street you're very conscious of nurses and doctors and everybody working in there minding their backs.
Yeah, actually, like, if you think about it, all the care staff are involved heavily in lifting people and helping them. So they actually have an education programme in the hospital for all the nurses and all staff, even someone who's working in an office, in terms of their posture and looking after the musculoskeletal. So it's kind of really, really important, like a holistic approach to actually caring for the staff, because if they're better equipped to mind themselves, they can help patients better and things like that. So it's a great programme. It's run at lunchtimes to kind of get people involved.
It's great that awareness is there now, isn't it?
Yeah, definitely.
Mary, I mean, I'm really upset for Andrea to hear her talk about how it affected you mentally. Like you suffered from depression, essentially, as a result of it.
Yeah, no, it's like a weird thing. One of the things that I'm reading here, it says back pain is not a disease but a symptom. I disagree. Chronic pain is a disease, and it's a disease in its own right, and it should be treated with the same urgency as any other disease. So like if you have MS, which is very similar to having chronic back pain or all these sort of things, or you have diabetes, you can kind of go, I have diabetes. When you've back pain, like when I say I have back pain, it's in my facet joint, so it's neck, it's lower back, it goes down my sciatica.
Do you think people are dismissive of it?
People just don't understand it, and they just think, because if you have acute back pain, that's, you know, if you hurt your disc, it's so sore, but you might be out of work for 2 weeks, you come back and you feel really good. But chronic pain is just something very different, and I think the government has to realise that is, and I don't believe that it's not a disease, it's a symptom. But I don't have anything wrong with me.
It's costing us a staggering amount of money,
Yes,
534 billion.
Chronic pain organisation with Europe, and part of it because I helped to set it up. Negotiates throughout Europe. So, I mean, it is now recognised in a way that it mightn't have been when you were first experiencing
If I can bring Mary in, do you think, like, if somebody comes to work and they say, oh, I have X, I have to get my leg amputated, and if somebody else comes in and goes, oh, I've got chronic pain, is there the same level of, you know, do people have sympathy for people in chronic pain? Do we understand?
I think we could do an awful lot better in that regard, for sure. And it's the same with mental illness as well. You can't see it, so people don't have the same level of compassion, which is absolutely no excuse, by the way. And I'm just sitting here thinking to myself, you know, we should be thinking about back health.
Yeah.
We don't, I mean, I spend so long sitting at a screen every day, and I'm not thinking about my posture, and I'm not thinking about what that does to you over time, and I'm not thinking about where my arms are and where my keyboard is and all the rest of it. And I know I've been in workplaces where heavy lifting was involved, and you get the courses. And I'm not sure that I paid enough attention to how to actually physically lift things properly.
Yeah.
So I think this is a really important discussion to be having, because we think about our health in terms of our exercise and what we're eating and all the rest of it.
I mean,
But
look at
your
kids in
back.
school and they're lugging those massive school
Oh my
bags.
goodness, absolutely. Like, your back is such a delicate area, and once you damage it, you know, there can be very little can be done to rectify it. So how do you keep it healthy? And of course, when you're suffering with chronic pain, to be aware, you know, and to be definitely more compassionate.
Yeah.
Okay, on that note, we're going to have to leave it. We want to hear about your